My name is Karen Lee Harrington, and I work with the Maine Health Data Organization. And I want to, again, thank you all for taking time out of your busy schedules to join us for our hospital data submitter webinar. It's hard to believe it's this time of year again. I feel like I was just celebrating New Year's, and here we are well into the month of March, and spring is here. So just a few reminders. If you could mute your phone during this session, that would be great. Submit your questions as we go through the presentation via the chat feature. And we'll try and address as many questions as we can before we end today's webinar. For those that we can't answer, we will get back to you all in an FAQ that we'll post in the portal. And then a recording of the webinar will be available on the MHDO website shortly after this session for those folks that you might want to forward in your organization, or for those that weren't able to join us today. So with that said, quickly, the agenda today is to review some of the annual administrative updates and review resources that are available, and then of course answer any questions that you may have. I don't think this session will be very long, but we want to make it as instructive for those of you that are responsible for submitting this data to MHDO. So at this point, I think my job is done, and I'm going to turn it over to Kate Mullins from our data vendor, who will walk through today's presentation. And also just let you all know that I know you all know Kim Bonson with MHDO. She's our compliance officer, and she's also on the call and will be assisting with any questions or issues that come up. So again, thank you all for taking time to be here this afternoon, and mostly thank you for all of your efforts to submit the hospital data to MHDO. This data is used by a number of different folks, including many of the hospitals themselves, whether it be the planning departments or financial offices, the Maine Hospital Association. So this data is used. It just doesn't go into a black box. It's really important information that's being looked at in terms of different policy questions and things like that. So again, thank you for everything that you do to get us this data. And with that said, I'm going to turn it over to Kate, and we'll go from there.
Thank you, Karen Lee. So first, we're just going to cover some information that should be pretty familiar to those of you who have been submitting for a couple of years. We're at the point of our annual reset of exemption and profile level validation overrides. This was going to happen on April 4th. New overrides will need to be requested for the 2023 files that will begin to be submitted, and any resubmissions or late data that's coming in during that time. So again, all existing profile and exemption level data validation overrides will expire as of April 4th. Again, any Q1 2023 data or late Q4 2022 data will then be evaluated against all of the validation rules, and new overrides will need to be submitted based on those results. The other annual update that's coming is the annual registration updates, which involves taking a look at your facility information, users, contacts, and the summary information about your facility. So all hospital registration information, user permissions, contact information, and summary information, such as the facility's campus and campus sub-entities or clinics and data streams, need to be reviewed and updated annually. During the month of April, hospitals will complete those updates in the portal, and we will be providing detailed instructions on what to review and how to make those updates by April 3rd, 2023. The next set of updates is just related to validation rule updates. There are some changes that were effective back in December that we wanted to take some time to point out and review. And then there are a few changes that will be happening in April that we wanted to highlight as well. So back in December, we did make some adjustments to avoid some false failures that some of you were experiencing when you were submitting your data. And a lot of them are related to some new COVID-related codes or other new emerging codes that had been added. So as a result, we've lowered some thresholds for 3 high impact validation rules. And these changes did go into effect back in December on the 14th. And I'm just gonna provide some additional information kind of about what we did here, so, and why. So the typical schedule for each code list that we use in these validation rules is to have them updated by the 1st of the month in which the quarterly hospital data are due. So for example, we look back at the Q4 2022 data, which are due at the end of this month, March. We want to have all of those newly effective lists for that data period in place by March 1st. So that when you're beginning to submit, when most of you are submitting the majority of those Q1 or Q4 data files, they'll be available. Last year, there were a huge amount of changes that were happening ad hoc related to COVID. And as I said, some other new emerging things that were going on. And we were performing ad hoc updates, which ultimately impacted our regular schedule for some of the other lists as well. And we're trying to get back on track. And I think we've been able to do that so that we're back on schedule and making sure the majority of the lists, when available, are updated prior to those periods in which you're submitting the most of your data. But again, in order to reduce some administrative burden that some of you are experiencing, we did make these adjustments to 3 high impact rules for valid procedure code, the primary one, the number 2 and number 3, which are ad hoc rules, and we lowered the thresholds so that if there are continued ad hoc updates to those lists that are happening in your systems that we're not keeping up with, that you won't get a validation issue that you need to respond to. So I'll just pause there. See, Kim, if you have anything you want to add.
No, I thought you explained it pretty well.
Okay.
Again, it's just to lessen the burden of what we consider false failures. HSRI has been working really hard trying to keep those tables updated with the new codes, but there've just been so many.
Thank you, Kim. So the next slide here is about upcoming changes. There are 2 rules that we'll be making updates to that will go into effect on April 4th. That should say 2023, not 2022, apologies. So the first is the type of bill populated. So this field, we've added some conditional logic so that a blank will be accepted for records that are associated with a limited set of revenue codes. And then the next one is the valid date of birth for newborn diagnosis. We've changed this from ad hoc to profile level and lowered the threshold from 99.5% to 95%. And this is related to, there are some specific ICD-10 codes that may be used throughout the life of a patient if the condition is still present, even, might be present for a newborn and then continues to be present later in life. So we've made those changes to the rule type and the threshold based on what was coming through and what we were seeing for our failures. And again, I think all of this goes back to, the great feedback you all provide and explanations in your overrides that allow us to dig into this and really understand what's going on in your systems so that we can make adjustments as well. So again, Kim, I'll just pause and see if there's anything else you want to add.
I just want to add the type of bill. So the revenue codes that we're allowing for type of bill to be blank are basically professional services that weren't separated out previously, like labs, freestanding clinics, visits, pharmaceuticals. So it should lessen the false negatives quite a bit. And the date of birth, the newborn diagnosis, the hospital did specifically point that out to us, and we figured by changing from profile, from ad hoc to profile level, you only have to change, you only have to explain the failure for one time, and it'll cover the year, so that will reduce the burden. And we figure this will decrease the burden for about anywhere from 20 to 40% of the hospital. So we're pretty excited to help you folks out with that.
Thank you, Kim. Okay. Move on. Again, just to put all of these dates in one place. The instructions for the annual registration updates will be emailed out on April 3rd. Expiration of annual exemption and profile level overrides will happen on April 4th. And we are asking that you all do perform your registration updates by the end of April. And just a friendly reminder about the deadline for the Q1 data is 6/30/23. Next, just want to reiterate the resources available to you if you need support. The MHDO help desk is available via a contact form that's in the portal, a email address and phone number, and Kim is available for compliance related questions as well. So I think we'll pause here and see if there are any questions that people want to submit through the chat. I think also, we're not a huge group. If you do want to unmute yourself and just ask a question, please feel free.
This is Mark Zevekas from Covenant Health. I am brand new to this. I just came on board within a few months ago. Who's the best person to reach out? Because I have no idea what, overrides and all that stuff. You're talking about submissions and stuff. Who would be the best person to get like a nice little training on that?
Well, first, this is Karen Lee. Let me just jump in and say welcome. And we'd be happy to chat with you. And Kim Bonson, it would make sense if you agree, if maybe you start that conversation.
Yes, Mark and I have had some emails recently, so yes, welcome aboard. And if Mark, it's easier, we can set up a Zoom call and go forward from there.
That would be great, because I know I've got a deadline looking at me for the fourth quarter of 2022, and because of our whole system change that occurred on October 1st of last year, it got a lot of things that we're going to need to work through those new files. So the sooner the better.
Okay, I'll send you an email after the meeting, and we can set up a time for our Zoom.
Thank you.
You're welcome.
Are there any other questions? I don't see anything, Kim and Kate, in the chat.
No.
We don't want to keep you any longer than we need to, so I'll just ask one more time. Any other questions? Again, we'll have a recording of this webinar. We'll post the presentation as well on the website. And if you do think of questions, please reach out to us. Otherwise, I think Hearing no other questions, nothing in the chat, we'll conclude the session for today. And again, thank you for taking time, meeting with us this afternoon, and look forward to your data submissions going forward. Thanks, everybody.
Thank you.
Bye.
Thank you, everybody.